Hello, everyone. Welcome back to Medscape. I'm Dr. Drew Ramsey, and I have a lot of questions about mental health, my mental health, and what's going on today in mental health. So I've invited Dr. Sue Varma to join me in a conversation to talk about what's happening to all of us right now as we emerge from the pandemic. Dr. Varma, everyone knows, is all over national media, but is also an assistant clinical professor at NYU. I'm a clinical assistant professor at Columbia University, and welcome to our conversation, Dr. Varma.
Hi, thank you so much, Dr. Ramsey. So great to see you again.
It's really great to see you. I realized in our conversation, you're one of the friends that I would occasionally bump into and see, and I haven't seen you for over a year and a half now, and it just made me very nostalgic for our collegial times, getting together in conferences, and that we've been missing. It seems we're going to have again, and then I realized maybe I was just calling you because I'm wondering, how do I figure out if I'm burned out or not, Dr. Varma, and what am I supposed to do about it?
Yes. So great question, Dr. Ramsey. And the point is that all of us on some level are feeling the weight. And we're feeling the weight because we are dealing with a lot of the same things that our patients are. And this is a really unique time. The last time I remember having an experience like this was maybe 9/11, where everybody's experiencing some level of loss, grief, trauma, and we're holding space for our patients and simultaneously are dealing with things at home. And, both of us have families and we're, homeschooling. There's a lot going on. There's a lot of hats we're wearing. But when we talk about burnout, certain key things I look for is exhaustion, physically, mentally, a level of cynicism, irritability, and, not really looking forward to the day, not feeling that same level of joy and pleasure and meaning. And that's tricky because we're so connected to the work that we do. I've had so many conversations with you, Dr. Drew. I know you love what you do and you get so much pleasure and joy. So it's hard for us to deal with these simultaneous feelings of like, I want to be there for everybody, but I also want to maintain my own sanity.
I think it's a scary moment because so many of us in medicine and in mental health, we do take such a pleasure from the work. And I find often after maybe a weekend, especially a really scary weekend of the pandemic, to get back into the Zoom cage and see patients, it was orienting and surprising to me how much that really was an essential part of my staying well during the pandemic and continuing. It certainly is a scary feeling I think all clinicians have if you have one of those days where you're not feeling connected to the work. And I'm wondering
Mhm.
in your life when that happens to you, that doesn't mean to have a day or two like that you're burned out, but what do you start to do to try and shift that trajectory in your own life and your own practice?
Yes. So one thing I realized that we're missing, Dr. Drew, and there are a lot of clinicians who have it, telehealth practice exclusively, but what I miss is the face-to-face in-person meeting. And I think that, whether it be the screen time, the blue light, there's something about it that's an added maybe perhaps issue with the burnout. And so for me, I think, returning to the basics, having some protected time between, work and home. One thing that I was finding during the pandemic is that a lot of people really didn't have a separation, not only in their own lives, but with their therapists. They would say, well, Dr. Varma, it's a pandemic. Where else would you be at 8 p.m.? Can you see me? Can you see me at 9 p.m.? Can you see me on a Saturday? Can you see me on a Sunday? So as much as I take so much pride in being available, and, honestly, I look at my patients in the same way I look at family. They take priority to me. I love what I do. To me, this is a calling. It's not necessarily a profession or a career. And I had to set boundaries and I had to say, yes, it's a pandemic. No, I'm not going anywhere, but I don't necessarily have to tell my patient that. I just say, I'm sorry, I'm not available after this time, or the weekends really aren't great for me. And I needed that so I could reboot and recharge and then give them the 150% that I'm used to giving, but I had to have that work-life separation. And going back to getting adequate sleep, getting exposure to daytime sunlight, taking breaks in between, it was hard because we think that we have all the free time in the world. We're home, right? But we had added responsibility. Maybe we had young kids banging on our door. How do I get my, computer to work for school? So there's a lot happening, and the boundaries and self-care became important to me in a way that I don't think I was so aware because we had natural separation. We went to an office. Our day ended when we left that office in some regards.
Yeah, that's been a big part. Certainly, I felt when I went and saw some patients in person in New York for the first time in a while, I felt this real sense of relaxation because my kids and family weren't, like a sliding door away, and it allowed a kind of focus that I certainly have, but there's just a little bit more of what I felt insulation of the experience and around the frame of the work. At the same time, trying to understand how digital mental health challenges boundaries and also challenges our notion of what we offer when we offer it. I've heard of so many people having, much more kind of flexible and creative notions of how they're doing their work. I'm wondering, are you going to go back 100%? Are you thinking you'll stay some telemedicine? And how are you working through that decision?
Yes. It's tricky because I love seeing people in person. And at the same time, I think, both you and I, our professions are unique in that we have a lot of creative endeavors. And we, do stuff on television and we write and we speak. So I do think that the telehealth gives us the opportunity to really be anywhere and to do our work. So I love that. But I also do miss the in person. So I'm going to really leave it up to patients. I think for a lot of patients, especially younger ones, this is how they communicate. And for some people, they feel like they must see you in person, that there's something real, like very tangible that comes out of this. But, for a lot of people also, they're not working in their offices 5 days a week yet. So I think that is going to be the biggest shift. For a lot of them, their companies have said going back in September and the fall of 2021, and they'll leave it up to people. They'll expect 1 or 2 days to come in. So, a lot of the people were working in the city and they've left, or they live in sort of the boroughs or the surrounding areas, or they've moved. So it'll be interesting to see what's happening. And I think it's going to be in part driven by patients and also part driven by my own sort of flexibility and the different hats that I wear.
I'm sure everybody watching it is having similar questions. If you're in mental health, it feels like my entire practice is either bought or sold their house, like moved in with a parent, moved out with a parent. It's such a tumultuous time. And Dr. Sue, I appreciate what you were saying earlier in the sense of being in it and going through it with patients has really created this, uh, I think, extra layer of a type of alliance. It's been very strange for me in the midst of some moves and some changes where perhaps it's really changing the patient experience of us, right? In the past, if you'd move towns or move states, that you terminate with everyone. And now there's a different type of flexibility as patients move, as we move to continue clinical care, if that's what you want to do. It's also strange then as you're going through transitions yourself, in terms of what do you disclose to patients. At one point, I'd moved my family to Indiana, but I was still seeing patients in New York every week. And I had this real determination, like I wasn't going to tell anyone because I didn't want to disrupt the frame with like my personal stuff. And then it also felt a little inauthentic and kind of sneaky, and it was interesting to kind of go through that and contrast that to now, where everything's digital, where we are, what we're doing. The Zoom cage background changes, and people are curious. I'm wondering, is you're doing a mixed model. One, how long you've been doing that kind of mixed model of in person and telepsych? Are we really going to something that's different, or have we had this model for a while? And then two, how you're hearing other clinicians are kind of uh, contending with this.
Yes. I've had a few clinicians who like made the decision very early on in the pandemic, that they were going to switch to telehealth and they were going to make that move permanently. And some of it was driven by, am I renting an office? It's in New York City. It's very expensive. When does my lease end? When does that actually terminate? So I think so many different clinicians, have had different ideas of going back, and also the hybrid model that we talk about. Like, so, I mean, I guess the assumption is we're talking about the private practice clinician. So just as patients are having this hybrid of 1 or 2 days a week in person and some days telehealth, I think that clinicians are also doing the same thing. One thing, Drew, that I noticed that's changing is this idea of more group practices forming, because people are really longing. I think, so many of us are practicing in these silos and we're sort of isolated doing our own thing.
That's been the best part. I mean, that for me, that has gotten me through the pandemic is our group practice. I mean, we now have 5 clinicians and meeting weekly,
Wonderful.
talking about our challenges in terms of either treatments or what's going on in our personal lives that are affecting our work. It's been really critical. I think what's really shifted in terms of the digital model is our our clinical team is all over the country, and we're licensed all over the country. And we've never had that kind of idea or flexibility. There was a way prior to the pandemic that digital health and digital mental health, felt a little bit like the bastard stepchild of real in-person health. And And I think the jolt of innovation that's happened that's forced us to really reconsider, how do we create team? How do we create community? How much of that I miss in person a lot. How much of that is a cost that allows us, if we have other models, to engage more people. And I think both in private practice, but also in larger medical systems, as you think about outreach, as you think about all of the challenges, for example, in access and travel and commuting.
Mhm,
I ran
mhm.
a community mental health program. Patients would sometimes have to commute 30, 40 minutes, an hour. Well, the idea that for some things, not everything in mental health, we can eliminate that and not have that burden affect our treatment, that's very exciting to me, and I think exciting to patients.
Absolutely. And when yeah, I'm thinking about continuity of care, when people are traveling, patients are traveling for work, and they might be assigned 2 or 3 months. Let's say if they're consultants or whatever they might be doing, or if they're parents and they can't leave home because they don't have childcare or whatever the case might be, or illness. So I love the fact that telehealth really allows us so many options. And I know some clinicians who are even seeing patients abroad, and just the idea that you can find somebody that you connect with, because so much of therapy, when people tell me I had been to therapy and I had such a bad experience, I look at it as the goodness of fit, and in between patient and clinician. And that's so important. And I say, don't give up, keep trying. Just like, if somebody said I went on one bad date and that didn't work out, like, we would never, if somebody's very motivated and eager, it's a partnership of a sort, and a very important partnership. And so if we can cast a wider net to find somebody that understands us, in terms of cultural background, racial background, whatever it might be, that, diversities become forefront of our conversation. And how do we identify and finding a clinician that can uniquely and is qualified to understand what we're going through? I think telehealth also allows us that opportunity. So I think it's really exciting. And that what you're saying is, this used to be sort of the stepchild or bastard child, and now it's the way of doing things.
I think we're in a transition where a lot of us miss in person and weren't forced to really quantify and understand what that actually was, what the costs of it were, and what the benefits of it were. And we have some ideas about that. And then there's been an explosion of models, some of which I think don't work for mental health, but data says they do, like asynchronous texting, the idea that just
Mhm.
sending text messages to patients, even if it's automated, can prevent suicide, improve medication compliance. That's exciting. At the same time, that's a very new idea and model. And wondering, how does that inform my clinical practice? Where at least
Mhm.
when I initially trained, I think we trained around the same time. It was a big deal. Like, do you give
Yes.
patients your cell phone number? Like,
Yes.
don't text with. I remember the first resident that gave out their cell phone number, and there was like a gasp. Like, oh no, like you missed that note. Like, you can't let patient. No, text with patients. Even if you have great boundaries, your patients pop up recommended as someone to connect with on LinkedIn or social
Mhm.
media or on Facebook. There's really been this challenge, I think, to our notions of how
Yes.
do we access patients, what services can we provide them, and what do people want in terms of taking care of their mental health? Where there is, I think, a demand of mental health and psychiatry to really up level our game. I mean, I think the
Mhm.
competition that is out there that's delivering better services in terms of people taking care of their mental wellness, I think it's quite
Mhm.
significant. I think a lot of folks are doing a better job.
Mhm. A couple things come to mind. One is, meeting your patients where they're at, right? So we have to evolve as technology it evolves and time evolves. And I think that what people want
Right
now
here, this is
is,
where I'm at. Anytime you
yeah.
need me, give me a call. Let's text. That happened. I mean, I'm teasing a little bit, but I have a patient who is a young physician and starting off. We all remember that was like, and really, it's the week before she's going to be wearing the long coat, and was really struggling last session. And it was nice to say, hey, I can see you later this week if you need to. It felt like the right thing clinically to send a text. Took 10, 30 seconds. Hey, hope you're doing all right. And then to see the patient again today and be able to fit them in because of the flexibility of telehealth. I mean, that's, to me, it feels like a great level of care. And in a way, I think that used to feel like people not having boundaries. And I wonder how I mean, I appreciate what you said earlier, that part of you avoiding burnout was realizing and wanting to care for everybody. You hadn't sent specific times where Dr. Varma is in and Dr. Varma isn't in. And I'm wondering, where do you find that balance behind like, wow, we're next level available and I've got boundaries?
Yes. Look, my default has always been to always be available because, like I said, this to me is so much more than just a job. But in the pandemic, with sort of 24/7 being plugged into the news cycle,
I
because so
think we
much of
just
what I
should like raise the teacup and cheer all the
yes,
clinicians out there who are on
yes,
their own or in a small group, and you're on 24/7 call. And I
yes,
think part of the reason that Dr. Sue and I wanted to get together and talk about that was the weight of what that has been for all of us of holding
hmm
space. I kind of joked with Sue before this. I said, when am I allowed to take a vacation? So many of you have been out there taking care of your patients, taking care of your families, and taking care of yourselves. And I think we wanted to talk about some of the ways or some of the issues that are coming up for us as we've also been doing that in
yes,
ways that we need to really bond together to make sure that this next year includes for you and for us some
yes,
recovery, some notion
yes.
of reestablishing and understanding boundaries, and really taking that step back in a way that we used to be able to and we kind of can't because we some of us don't have a workplace to really think about how did this change my workspace and my
And
work.
Dr. Drury, what you're also bringing to light is the fact that our patients for the first time are seeing us as people, right? Because before you were a clinician and they didn't, there was the neutral, objective, blank slate. Now you're a human being to them. There's a little bit
Dr.
more.
Sue, I wrote a cookbook, a sexy cookbook about kale like years ago. So I think unfortunately my patients they got a little dose of who I am. It's maybe not unfortunately, but I do I do know what you mean in the what and also what we learned. The puppies, the dogs. I met like girlfriends, boyfriends, kids, like, hey, come meet Dr. Ramsey. And
Yes,
suddenly
yes,
there's this kid you've been hearing about their whole life,
yes,
some little,
yes.
6 or 7 year
But
old that you
when you're talking about vacation, how do I take a vacation? So you're on social media, right? Both of us are on social media. So that already is a little bit out of the box in the sense that there's a three-dimensional aspect
I loved your
to
last
you.
vacation. What's out of the I love that last vacation you went on. I was like vicariously with you. I was like, Sue, I
Yeah,
was like,
yeah.
it
So
was refreshing for me. I was so happy for you. And
Oh,
you
thank
know,
you. And it was much needed. It was much needed. And my patients asked me about it. And I think a lot of my patients, they say, Dr. Rama, you practice what you preach, and we appreciate it. Because I always tell them, take vacations. There's a 65-year-old couple that I treat, and the wife works 24/7. She's a lawyer. She has her own practice. And when I told her I'm going to be away, and she's like, "Good for you. I'm really happy to hear that." So I know that you're taking your own advice, and because
I,
that's what I
I
tell
tell
her all the
patients, I tell patients, I say, I don't mean to harsh, but I think you're really bad at this part, like taking vacation and really taking in all the success you've had that you can have a vacation. I think that people really struggle with that, and it's hard right now. Our kids aren't
Yes,
vaccinated. We are. It's as we're planning stuff, there's this excitement, and then there's feeling of like, oh, I'm gonna get on the plane, and really like the risk is different than it was a year ago, but my kids are still at risk in a way. And so I think
yeah,
that mixed emotions that we're all kind of struggling with of how do we,
yes.
what feels safe? How did you feel being out and about and with your family? And I guess my question is for those of us who are thinking about this idea of vacation and following Dr. Sue's good example, how was it?
Yeah, no, it was liberating, I have to say. I have a mask, I'm vaccinated, and there's risk involved, but it's a calculated risk, but it was good weather. We're outside the whole time. And I felt like it was restorative and much needed. And at some point you're going to have to continue living, and there's something I wanted to say, Dr. Drew, when you were asking about patients and boundaries. I think one thing that's really key, what you were talking about by texting your patient, is this idea of emotional attunement. Like you're in tune with your patients. And so I feel like even when we set boundaries with them, your patient knows my doctor sees me, they got my back, they're thinking about me, right? And I think that boundary doesn't then come as harsh and punitive. It comes out of respect and love for both parties.
Well, I think you also say a nice thing, which is that we think sometimes of boundaries as walls. And that's maybe not how they really exist. Boundaries are more like they're more like hedges. You can always walk through them if you need to and find your
Hmm.
way, and you
Hmm.
want to be mindful if you do make sure, that they are there to signal and demarcate traveling into a different territory or certain space, but it's not a boundary, isn't a wall. Dr. Sue, I hope that everyone hears your encouragement to take vacation. It is, I think, a liberating feeling, and it's one of the ways that I think all of us can really determine: are we burning out, or are we getting depressed, or are we really affected by the pandemic in a way that we didn't pay attention to because we were holding space for so many people? I think if you go away and after a day or two, or sometimes when I'm on a 3-day vacation, it's like, I can't believe it feels like I've been away for a month. To me, that's
Hmm.
an indicator that I'm really quickly kind of, and I see it like a sponge, and I'm rejuvenating and returning to the state that I know is me feeling well and doing well. And I think if you're not getting that and you find yourself still grinding and still struggling, that's when it's time to double down either on the 4 M's that Dr. Sue talks about in terms of how to take care of mental health, or whether eating some of the brain foods that I recommend via nutritional psychiatry, or using whatever techniques help for you. I hope you hear our encouragement to continue taking care of your mental health and your mental fitness. Keep tuning in to our videos on Medscape to help you do that. And Dr. Sue, thank you so much for joining us and for chatting about your transition back, about your practice and your patients, and how you're taking care of yourself, avoiding burnout as we all transition into this next stage of what into this next state of our profession and what mental health looks like it's going to be.
Thank you, Dr. Drew. And just to quickly say what the 4 M's are, so nobody's left hanging: movement, mastery, meaningful engagement, and mindfulness. And these are all things that you can do 10 or 15 minutes a day. And like Dr. Drew said, if you're not feeling well, talk to somebody. We are in this profession, right? And we can guide each other and give good referrals. And I find therapy, I had to do a check in with a therapist that I had worked with many years ago, actually during residency, when we all had to go to therapy. And I did one session with her, and it was necessary. And she's a cognitive behavioral therapist, and that's what I do in my practice. And it was, and now I feel like the relationship is probably more collegial, but it was very helpful just to even get a reminder. I think even though I tell everybody about the 4 M's, it was nice for her to say, Sue, did you do the body scan meditation? I'm a big believer in MBSR, mindfulness based stress reduction. And just doing the body scan every day. I'm a huge fan of John Kabat-Zinn, his book, Wherever You Go, There You Are. And it just took me back to, I need to prioritize myself. And it was that conversation that said, okay, this is what I need to do. So don't be afraid to have a check-in with whoever
Oh,
you
have a
trust. And then,
check-in, or be like me. I've been in weekly treatment throughout the pandemic. My
awesome.
very lovely elderly, I shouldn't say elderly, but senior psychoanalyst was sure he's not going to go into this silly FaceTime thing, and he's been seeing me religiously by telepsychiatry or telehealth, and is actually not going back to the office. And so I think whether it's seeing a therapist, or as some of you who see me on social know, I fell in love with the horse, is how I've taken care of my mental health. And I think about mastery all the time. Each time I feel a little more confident on the horse, I think about the way that mastery is
Mm,
really, really helping fuel me and helping keep me mentally well. Sue, thank you so much, everybody who's stayed with
thank
us.
you.
Thank you so much. Stay tuned, and we'll see you soon.
Take care. Thank you, Drew.